So this is looking in your lateral compartment or the outside part of your knee joint, and I'm just doing this so that I know that we're not missing anything else here. The lateral meniscus looks perfect. You see it's not torn, it's nice and stable. We'll take a still capture of that in a second. That's what a meniscus is supposed to look like, and there's no arthritis there. Whereas there's quite a bit of wear and tear on the end of your thigh bone here on the medial side if you compare. We're just going to pop the scope underneath your kneecap. Got a little bit of roughening there, shaver please. So we'll just smooth that down a bit. A little bit of fat in the way here that we're just going to get rid of first. And smooth down this part right here. Just on the undersurface of your kneecap, we're giving it a bit of a trim, a haircut. Okay, the rest of your kneecap looks good. Okay, so now on to the ACL reconstruction. Pro, please. So your ACL is going to go from here, you can see the remnants of your old ACL, up into here. That's the direction that your ACL is going to pass. So I'll take the gold guide next, please. Just hold this. I use the elbow guide. Can I get the elbow guide? Yeah. Yep. This one just aims to the elbow of the guide, and that one aims to the tip. Okay, so no problem. You'll see a gold guide come here in a second. And what I do is I start drilling with a small little guide wire. See, is your cord in? There, we got some power now. So it's going to be a little 2mm guide wire that I use to drill a tract. There. Quite happy with that position. That looks good. Depth gauge. Or not a depth gauge, Chucky. Out of sequence here. Okay. So I'll take the cannulated reamer next. This is a 7, right?
7, yeah.
Alright, so we're creating a 7.5mm tunnel. So what I do is I drill with this 7. There's a 7mm drill that goes on top of this guide wire. It's cannulated. See that? As it comes through. And you can see why I use the guide wire first is because if I want to reposition, I don't want to reposition with a big 7mm reamer because I'm going to keep making different holes in there. So there we go. I'll take the dilator next. So I drilled the 7, and I'm going to dilate mallet the tunnel up in size, make it 7.5. There we go. So we just hammer that up so that it doesn't. I'll take a 7/8 white plug so it doesn't remove bone.
The 7 is 8. You said 7/8.
Yeah, I thought there was a 7/8, but okay. So there's the tibial tunnel, you see it, and that's where the graft is going to come out from the tibia. And then we're going to create the femoral tunnel here in a second. So load up the long guide wire again, please.
Long guide wire?
Yep, hold the knee right there. Take the shaver. The long guide wire first. So this is where the femoral tunnel is going to go here in a second. So I'll take the 4mm offset guide next, please. You doing okay, Milan?
Yep.